hawakan, wag dito hindi dito. Kasi pag dito pwedeng lumagpas yung needle, matutusok ka. That's why hold here, yung sa matigas. And then bullseye, ganito paghawak, and then insert sa gitna. Pagka hindi siya nagdire-diretso, ibig sabihin wala ka sa gitna. Wait lang. O, ayan. Okay, so definitely, nandyan na siya. Okay? So I have to place it here, and then place the end of this again dito. Yan na siya. But definitely, I have to clean first the, ganun din, i-clean mo rin yung with the use of your Q-tips. So this is my non-dominant hand. So I have to hold the penis at a 45 degrees or perpendicular position to the patient's body until ganito. So, clean ka muna. Okay? Tapon. Isa ulit. And then out. And then one. Okay, out. Okay, so I'm now ready to insert now the catheter and holding still on a perpendicular on a 45 degrees angle of the penis. So I'm now ready to insert then lubricate already the end of the catheter. Here, meron na siya. Ayun na siya. So you have to insert now. So hawakan nyo dito, wag dito sa dulo ha. Kasi para 2 to 3 inches na doon hahawakan siya. And then you just insert and then move your hand and then until the urine comes out from its end and slowly advance the catheter into the bladder. Okay? So ayan, 6 to 9 inches mo siya ikakabit. Okay? So usually yan, medyo malapit na yan dito sa end. Okay? So after that, you could now inject. So, inject ko na yung I'm going to inject now. So, ganito yung paghawak ha. Inject nyo guys ha. And then you could hold now this one part and push now the 10 cc of the to form a balloon inside the papakita ko sa inyo yung balloon. Okay, so then after that, you could now remove this one. Remove and make sure na hindi ka matusok. And then you have to remove this so that you could anchor. Okay. Para mai-anchor mo siya. So you need to have wala tayong stabilizer. So definitely, sorry, wala akong stabilizer. So I have to, masyado kasi mahaba yung dulo niya. So definitely, nandito siya naka-attach dapat. So you have to place a plaster kasi wala pa tayong stabilizer dun sa thigh ng patient nyo. Okay? And then, you could now hang the urine bag again, and then make sure, and then you have to look kung nagde-drain na siya dito sa urine bag nyo. Okay, so, you have now to remove everything, dispose everything. Pati yung proof pad nyo. And then you can now remove your gloves. Okay, and then, definitely, lagyan mo na siya ng covering si patient. Okay, so, about para makita nyo yung sorry guys. Nakikita nyo? Ay, ayun. Nakikita nyo? This one. Ayun yun, no? Nandito na yung water. Nakikita nyo guys? Yan
Opo.
yung bearing balloon. Yan yung in-insert ko na 10cc. Kaya lang dito, hindi ko siya mapapakita sa inyo kasi sa Baby Alive, iba yung butas niya. Ito kasi binutasan ko yan sa likod. Okay, so ito na yung 10cc of water ninyo na in-inject nyo. Ganyan na magiging itsura niyan. Kaya kung hindi siya mahila kasi mahaba yung aking uh, DIY. Okay, so ganyan ang mangyayari talaga sa loob ng bladder ng patient nyo. Okay? So, kasi tumapon. Yan. Okay, now for the removal. So, sabi nga dun kanina, so, again, so, after muna mong ikabit pala yung you have to, after securing, you have to place the patient on a comfortable position, and then, discard mo na yung disposable equipments, and then you have to do the aftercare and perform hand hygiene. So, don't forget to evaluate the indwelling catheter that is draining onto the urine bag, and then you have to take note of the patient's comfortability, and if there is no bladder distension. You have to document the date, the time, the size of the catheter, and then whether the specimen is obtained, and then the amount, yung amount ng urine na nakuha mo, and as well as the description of the urine, kung bloody ba siya, kung anong kulay niya, and then the patient's response for the documentation. So that is the end for the insertion of the Foley catheter. And then for the removal, so definitely you have also seen a while ago that in the video that there is always a doctor's order. So again, you only need to have a 10cc syringe. And also a pair of clean gloves. But definitely you should know, um, so I have here the 10cc syringe, and then I have here the clean gloves. So definitely, you have to verify the doctor's order, determine whether a urine specimen is needed. So yun guys, ito nga pala, ito yung mumurahin, kaya wala siya yung sinasabi ko na pwede kang kumuha ng urine specimen. If the case is like this, ang gagawin mo, dito, tatanggalin mo yan para makakuha ka ng specimen. Kasi yung ganito niya ay wala siyang port, injection port. Kaya kung ganito yung urine bag ng pasyente mo, if you need to have a specimen, i-disconnect mo to para yung nito, ayan, let's say example, ganyan, naka-gloves ka, i-disconnect mo siya, and then ilagay mo na dun sa specimen bottle. Kunyari, ito yung specimen bottle, i-drain mo lang siya. Okay? So, ganun ang pagkuha ng specimen bottle, ay ng specimen urine, if ganito yung urine bag. Pagka kung meron naman na yung injection port, you just only withdraw a certain amount of fluids, certain amount of urine for the culture and sensitivity. So, ayan, you have to drip the patient. So, I have here now the 10cc syringe and a cotton balls. So, cotton balls kasi with the alcohol kasi wala tayong stabilizer, stock lock stabilizer. So, naka-plaster siya. That's why we have to make use of the cotton balls with alcohol. Okay? So after performing hand hygiene, na-introduce mo na yung self mo, and identify the patient. So you have to explain that the order is for the removal, or Mr. Chase, we have to remove now your Foley catheter, and then naka-drape na yung patient mo, and then you're now going to put on your clean gloves lang, or disposable gloves, non-sterile gloves. Okay, so after putting, so naka-drape na, you have to remove first kung naka-stock lock stabilizer, you have to remove the stock lock stabilizer. So in this case, wala tayo. So we have to make use of the cotton balls with alcohol. So make sure that you have to, okay, kunin mo yon. Yung sabi ko, pag nagre-remove ng IV, ganun pa din. Okay. And then on top, pilahin mo yung ibabaw, and then, okay, so na-remove na natin siya. So now, the next is after the removing the the anchor. So you're now ready to aspirate the 10 cc of the distilled water or the, okay. So ganun din, you have to hold like this, and then hold your syringe like this, and make sure na tama yung pagkaka-insert. So without pulling, lumalabas na si water. Kita nyo guys? Lumalabas na siya, oh. So if na hindi siya lumalabas, you have to pull the plunger ito. Hindi ko na siya pinupulo, lumabas na. Kita nyo? Lumabas na siya. Okay? But definitely, make sure that you have to really pull, and then make sure na dito, parang mag-stick siya na ganon. Ibig sabihin, wala nang water na natira doon. You just pull, you could see na mag-compress siya. Pag nag-compress na 100%, wala nang tubig. And then, you have to, hold this part, ito. I-control mo para hindi babalik yan. Kasi babalik yan eh. Okay? So, you have to control your plunger. Okay? Control mo. Kita nyo kung paano ko kinontrol. Ayan, oh. And then, here, nag-compress siya, and then, you can now pull. Okay? Then definitely, i-ano mo na lang siya, para hindi ka matusok. And then, instruct the patient to deep breathe. Okay? So, hinga po ng malalim. Okay? So, in this case, ang gagawin mo is to coil. Okay? So, you have to coil. Okay? So, make sure na iabang mo rito kasi baka mamaya tumalsik sa'yo yung end ng tubing na yan. Okay? So, you coil. So, hingang malalim, mister. O yan, i-coil mo yan sa daliri mo. And then, para yung dulo, hindi tatasik, nakaabang yung isang daliri mo dyan. Okay? So, coil. Ayan. Kasi pag gano'n yan, tatalsik yan eh. Kaya dapat hawakan mo siya, nandito yung kamay mo. And then, you have to disconnect. Ito. Disconnect mo na to. Ito. Dito. Okay? And then, you have to put this Foley catheter onto your gloves. But definitely before that putting on, you have to read first kung ilan yung laman ng iyong urine bag. Okay? So, I have now to discard, put it inside, and definitely, ayan na, ito namang urine bag ay hindi mo siya malalagay sa ano. So, lagay mo na siya sa trash can, kasama na yung ano mo. Ay, ano nangyari? Nawala ako. Wala ang connection ko.